Okay. Well, look like we're live. Hello, 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 hello. Just give it a few moments to see if everybody tunes in. Hello and welcome to the Global Youth Mental Health Awareness Show, where we have open conversations with the youth about mental health. I'm your host, KATINDA, NDOLA, the author of The Big Comeback and founder of the Confidence and Self-Esteem Academy, and one of Jim Herr's special board advisors. In today's show, we are so blessed to be in the presence of three amazing panelists. And our first panelist is, okay, see here we've got Avinash Patel. Avinash is a psychologist, therapist, career coach, educational consultant. Hello and welcome to the show, Avinash.
Yes.
Thank you. And our second panelist is Ivy Helena Mora. She is a psychology student and vice president of talent management at ISEC, Kenyatta University. Hello and welcome to the show, Ivy.
Hello, thank you very much.
Thank you. We have our third panelist, Xavier Effiong. Xavier is a clinical psychologist and a Jim Herr ambassador. Hello and welcome to the show, Xavier.
Hello, KATINDA. Good morning.
Good afternoon or good morning for you. Yes, okay. Now, in our conversation today, our guests will give us some insight on ground level execution of youth mental health awareness at a global level. But before we dive deeper into the show, I always like to ask, how are we feeling today? Ivy.
I am feeling so excited, especially because more of the mental health conversation is being brought less out of the Western world and more globally, because, you know, like culturally, more of us ethnic people, we're very stigmatized towards mental health. So I'm really looking forward to this conversation.
Thank you. Thank you. What about Xavier? How are you feeling this morning?
I'm feeling very great this morning. Hello, my listeners. I am very happy to back to the show once again. I really apologize for my inability to show up last time. I communicated with Jude why I did not, or why I wasn't able to join. So for today, I hope to that we're gonna have the best. We're gonna know or have more insight about mental health awareness and our overall well-being. Thank you so much, KATINDA, for moderating us.
Thank you. And what about Avinash? How are you feeling today?
I am very fine. And actually, I was waiting for such a moment where I can join the organization like this. Actually, we have so much thing inside, but we all need the platform which can we explore and execute the things and help the youth at their, particularly the mental health. Actually, they are facing different ways of challenging. So it's really nice to over here.
Yeah, thank you. Thank you. So today's topic is really about, again, youth with mental health awareness on a global level, like Ivy was saying. So what is the importance of mental health awareness? Who would like to take that first? Ivy, would you like to?
Yes, of course. Thank you. So it's very important to begin with starting. You need to know the what so that you can fix it. You need to know the problem so that you can begin to find a solution. In matters mental health, I think awareness is very important because, first of all, if we are aware of what's going on, then we can provide support for the people who are struggling. Because if you don't understand what a problem is, you can't find a way to fix it. Yeah. And so it's very important now, especially, for example, in the mental health space, we're talking a lot about things like depression, addiction, anxiety. And now, because we're aware of that, we're able to know, okay, if I meet an individual, they're struggling with this, and I can recognize that it is like an anxiety attack, I can support in this and that manner. While previously, when people didn't know, they would think, oh, there's just something strange with that person. So they were unable to help.
Yes, for sure. I think also the stigma, we've got a lot of stigma still around the mental health space. And a lot of people now, because of shows like this, this kind of show also, we are here to inspire, encourage, and also encourage people to actually seek for help. It's no longer a stigma, it's a real issue. And especially with the pandemic, you know, we're seeing, I guess maybe there's a lot of people who already had mental illness or mental health issues, but with the pandemic, it's actually triggered more. It's pushed people to the limit, and it's time to ask for help. You know, it's that time. Yes. So what about, Avinash, what would you say is the importance of mental health awareness?
I think it's I think people should prioritize it from every health, because everything is depends on the mental health. It's related with their body health, financial things, educational things. It's not just a single movement, it's across the life. Everything depends on the mental health. If if a single thing is not good in their mental health, then it can affect its whole life. So I think it's seriously, we have to take it very seriously, and we have to do the things which can, help out the youth.
Yes.
So I think it's just not the awareness. It should not be awareness itself, but I think it should be executed. Really, should be executed. This is the things which I want to talk.
Thank you. What about Xavier? Xavier, what is the importance of mental health awareness? What is your take on that?
Okay, thank you for this opportunity. So I would like to add to what the first speaker said. She said that before we can be able to create an awareness, you really have to know more about, what exactly you're going to talk about. So mental health awareness is very, very crucial in our society. We've seen a lot of benefits which are attached to this. When we educate people about mental health, we get to change their ideologies, their negative constructs or negative ideologies they hold towards mental health. Like in Nigeria, some people believe that those suffering from mental illness, that they are, possessed with demons. And that's bullshit, it's really wrong, the mental health space. So when we get to, get them aware of this, we get to reconstruct their ideologies, their thinking, structures, and tell them, no, come on, mental health illness is just a normal illness that can be treated, and can be cured. So when we do this, when we, spread this awareness, we also tend to eliminate stigma, just like KATINDA mentioned, the stigma people, put on people with mental illnesses from the negative ideologies will be able to be eliminated. We could put that off if we, create awareness to these people. And then lastly, let me add, it's also a form of education. When we create awareness, we are indirectly educating the public. We are telling them, man, these are the symptoms you're going to experience. And then when this happens, we know that you're having anxiety, depression, and other psychological issues. And this is what you could do in search of help. And when we do this, we see that we will actually save people from committing suicide. Long ago, you've been hearing of a lot of people committing suicide here in Nigeria some years ago. People died, young children died, just because they were not aware that, we have psychologists around, we have people that they could talk to, and then that could really, restructure their cognitions. But nowadays, the such is obtainable, and the suicide rate is really reduced. So yeah, it has a really, really, great importance. Mental health awareness in today's society. Thank you so much.
Thank you. And so how can we promote mental health awareness among the youth at ground level? Ivy.
Well, first of all, I think we can begin by using modern tools. The previous generation really used a lot of traditional media, things like newspapers and radio, but I can tell you for free, like most people my age, us 20-somethings, we're not actively buying newspapers or actively listening to the radio. So now what we can use is utilize modern tools. You have YouTube, you have Instagram, you have podcasts. Use these modern tools so that you can make it more accessible for the youth. And another thing which would support in the promotion of mental health awareness is to make most of our discussions about this culturally relevant. I think a big problem in the mental health space is that because most of these discussions began in the Western world, when we teach them or explain them or try to spread awareness, we still keep them in that Western context. So it's very difficult for us to understand because it's not something we can relate to. So to this day, that's why we get that stigma of those are Western people problems, or, Mzungu problems, as sometimes they're referred to, because if someone cannot understand, you're upset in like, let's say in America, someone would be like, you're upset, you're going through depression because you're about to move, your family moves a lot. We might not be able to understand that because we're like, okay, I cannot understand, that's not culturally relevant to me. But give an example, like, let's say maybe your farm, the harvest isn't doing well, and that will affect your family, and that will affect like the sales at the market and stuff like that. That's something that's more culturally relevant to us. An example it makes it easier for people to understand.
Wow, that is so true. I mean, I know definitely, because I live in Australia, of course, I would imagine, what we know in terms of how we get to understand mental health and how it's perceived is different. However, there is just the global thing where we still know the stigma actually is across the board. It's not just in Australia or in the West. The stigma thing is very big around the planet because, there's all different sorts of cultures. There's Asian cultures, there's European cultures, there's Muslim culture. There's so many cultures and everybody has their own belief system. So like Xavier was saying before, in Nigeria, if somebody was sort of disturbed in some sort, they would think he's possessed by something, as opposed to thinking this person might be ill, might need help. And that's just how cultures have been over the years. And I think with this awareness, with us talking about it, with everybody sharing this and everybody talking about it, it's getting normalized, I think. It's not so critical that if somebody's got mental health, you're going to freak out, that people are going to ostracize you from the society because something's really wrong with you. Yes. So Avinash, what's your take on that? How can we promote mental health awareness among the youth at ground level?
Look, I feel that each and every country, if we are talking about the global level. So I think each and every country, there is a particular area or state or city or the village, urban, there are many segments in each and everything. So these are the different platform. The different platform actually need different kind of execution. If we see in rural area in India, people doesn't have so much things. Even internet, they don't have internet. So such a things we have to establish a local level people over there. We have to provide them some skills or something like that. We have to tap with the NGO, some schools, or some government hospitals or something like that, so we can promote it very well. But if even further, if I see this, we actually need a micro level of analysis if we really want to execute it, because it's really real. Each and every parameter is very different things, and they are facing different problem. If the person in an urban city of India is facing some different issues than the rural, it's really different, and we need a particular type of services for them. We cannot, it means we have to go very deep at micro level so we can provide them the real solution. And this is how I see that these are the local things, local level, we have to localize it, and then we can get the real executions and real promotions.
Right.
And it's totally, it's really deeper level. It's not, we cannot get the result otherwise. If we are talking about the execution, then we have to go a micro level things, so we can sort it out and we can really provide the needed help, which actually they are facing a different issues, mental issues, a different kind of mental issues over there.
Now, just before we continue, I see here we've got a question. Most people are religious and spiritual. Is it
Yes.
right to fast and bind mental health disorders?
Pardon?
Okay, so most people are religious and spiritual. So is it right to cast and bind mental health disorders?
Okay, I think I should go in for that.
Okay, go for it, Xavier.
So, and these the question, I think it collaborates with the instance I stated while I was speaking, answering the first question. So spirituality, as we all know in the mental industry, it's one of the ideologies people held before towards mental health. Like we have the Hippocrates. They believe that mental illness is caused by spirituality or by demons. So as that person asked if that could be, we could bind mental illness or stuff, let me get this cleared up. Mental illness is not caused by demons. It's not caused by spirituality. It's normal illness, just like you have, or you suffer from, or you have malaria, you have HIV, you have hepatitis, you have tuberculosis. The same way we have mental illness, and the same way or means we use in treating tuberculosis, in treating malaria, in treating typhoid, the same way we treat mental illness. So I don't see any correlation between spirituality and mental illness. Thank you.
Now we have another question. How can we explain to people out there the difference between mental health disorder and psychiatric disorders?
I'd like to take that one, please.
Go for it.
So the difference between psychology, mental health disorders, and psychiatry, which is now where you involve medicines, is that for psychology, for your mental health disorders, for example, you have your depression, your anxiety, those ones, we can counter them, or we can help you deal or cope through therapy or counseling, such types of, to help you find positive ways to adapt and cope with these issues. But when it comes to psychiatry, that involves now, like doctors. Not to be a psychiatrist, you have the what's the word, qualifications, because there's medications involved, there's actual like testing on a very high level. For example, you cannot schizophrenia, now things like schizophrenia fall under things that psychiatrists can handle, you see. So, but you can't diagnose it on your own at a very basic level. You have to begin first by going to the psychologist so that they can help you figure out whether it's a mental health issue where you just need to cope and you can find ways to adapt and deal with it, or whether you will need to be passed on to a specialist who will help you even more, because in some cases you may need medication. That does not mean that there's something wrong with you as an individual or you're broken or something. It's just a little assistance to make it easier for you to find your path and figure your way out.
Sure, thank you. And the third question is, patients depend a lot on the therapist for recovery. How can we in GIMHA advocate for patient responsibility as an essential factor to that recovery?
Pardon?
Okay. Patients depend a lot on a therapist for recovery. How can we in GIMHA advocate for patient responsibility as an essential factor to their recovery?
Okay, let me take this. So we're trying to figure out how we in GIMHA can, advocate for patients to depend on themselves for recovery. It's what we do every day. You see, mostly in the GIMHA subgroups and other social media platforms, we most times, put in some tips on how to, uphold your mental health, on how to, secure your mental. We teach our clients, or we let the public know that, man, you have a lot to play in this. You have so much to do, so much to take care of your mental health. We say you don't get yourself involved in things that triggers anxiety, things that triggers depression. So, it's something we do every day. We spread the message. We send them. We send all the messages which would help guide you or the person on what to do, and not necessarily depending on therapists. If the case pass or goes beyond normal, that's when we now advise that to go for professional. But on a normal basis, we let people know how they could take care of themselves and not just depending totally on therapists. Thank you.
So how can we make sure that no society or country is left behind in the mental health awareness movement? Avinash, did you want to say that, or Ivy?
Do you mind? I'd like to go, if possible. I think this goes back once again to being culturally relevant in terms of the methods you're using and also in the way you're framing these conversations. To take an example from Nigeria, because we have a similar thing also in Kenya, where at some, like in the rural areas, yeah, if you have, like, let's say depression, they'd say, spirits or something's wrong with that person, they've been bewitched or something. So because you're aware of this, you can try and explain depression from a cultural lens, because things like depression is caused by things like stress, anxiety, and a lot of, like, let's say if someone goes through a lot of painful things one after the other, and these are concepts that are not necessarily new to our cultures. People understand pain, people understand sadness, and if you explain it through that lens, that it's culturally relevant, people can understand how it gets there. And you can use different methods, because, like, for example, this method of explaining in Kenya may not work the same way, for example, in India, yeah, because they have their own customs, they have their own beliefs, they have their own understandings of how to deal with certain problems, certain situations. So if you make it culturally relevant, in that everywhere you go, you're customizing, it's still the same concept of mental health awareness, but you're customizing it to fit that the people that you're trying to help, then it makes more sense. It's easier for them to take it in, swallow it, ingest, and like take it in as a method of life. And also with the methods that you're using, for example, if it's in the city, if it's among the youth, you go for social media. Like, this is an excellent platform. For example, right now, Facebook, we're using the social media. If it's in the village, use radio, because we have people there who maybe may not have access to phones. Just make sure you're customizing it so that it's easier for whoever you're targeting to ingest it and have access.
Thank you. Thank you. Avinash, what would you like to add to that? How can we make sure that no society or country is left behind in the mental health awareness movement?
Actually, I am a little bit confused about this question. You can elaborate it little bit. I'm not getting things.
Okay, so how can we make sure that no society or country is left behind in the mental health awareness movement? I believe from what Ivy was saying, it's more custom making everything, like if you're in the city, in terms of
Yes,
their
yes,
awareness.
yes. Now I got. No, now I got. Yes, this is as my colleague says, this is right. Actually, we have to customize it, and this is the way that we can actually before that I have mentioned that even in the India and even across the every country of the world, it is really different. So we have to make the different approaches to provide them the solutions and create mental health awareness. So yes, this is segment wise we have to do it. This is how we can complete.
Sure. Xavier, what about you? How can we make sure that no society or country is left behind in the mental health awareness movement? What are your
Okay,
thoughts?
I would like to build on what Ivy said. She said that that could be actually be customized based on the culture differences. So I would add to that governments also have a very large role to play in this. Making sure that no country, no society is left behind. Mental health awareness. I would say that the government has a lot to do here. In various countries or in various societies, there should be programs that are targeted towards vulnerable people, migrants, and people affected with conflict and other disasters. For instance, like Nigeria, we see that in northern part of Nigeria, we see where Boko Haram are actually terrorizing the zone, and then causing so many problems, conflicts, and people are suffering from diverse psychological issues ranging from PTSD to depression to panic and all the stuff. That goes beyond the individual level. It's worth calling for the government for intervention. They have to set up programs that are targeted towards culminating these issues. And then also government also has a role to play in the sense of preventing violence. They could bring up programs that helps restrict or put in policies that ban violence in the country. And then when these things happen, we'll see that mental health awareness and optimal mental health is actually obtained. And then also they could put up programs that aim at alleviating poverty and social protection for the poor. Poverty is one form or one thing that really triggers mental illness. So this goes beyond the individual level, or as I mentioned earlier. if the government could be able to, put up programs that aims at targeting or alleviating poverty in the society, in the country, we see that we will have optimum mental health being experienced by people. And also, lastly, I would say that should also put up policies that help to, put off anti discrimination, like discriminating people, people with mental illness, like in Nigeria. If we see someone who is mentally ill, people will tend to discriminate, not even stay close, not even go close. In fact, even giving to those people to even eat. Like most times I see people going to gutter to eat. If we have good citizens that really understand that we don't have to, discriminate among these people, they could be giving them food, giving them clothes to wear, and then even providing them with shelter. But this is happening because what the government does not take into consideration, and these guys are just screaming down the street like that. So I see that this role has to, we have to involve government because at some point it goes beyond the rural level. So government has a large role to play, in spreading mental health awareness and making its citizens or our citizens to obtain optimum mental health. Thank you so much.
Thank you, thank you, thank you so much for that. So if you just joined us, we're talking about ground level execution of youth mental health awareness at a global level. So please click, share, comment, and invite your friends to watch and ask questions, because that's why we are here, to encourage, to inspire, and to give you a platform where we can actually answer some of your pressing questions about mental health. So moving forward, during COVID and its restrictions, how can we promote mental health awareness among people with no access to the internet services? Ivy.
This one is, okay, I'm sure everyone understands because we've been through the same pandemic together, but this one hit particularly close to home. So during the pandemic, of course, first of all, that means no going outside to meet people. That means basically quarantine, you're stuck at home. So a lot of the ways that people subconsciously used to cope, like meeting your friends and going out, was out of the question, yeah? So the best way I think that people can really promote mental health during the pandemic, through all this chaos, through all the quarantine and all that, is providing a support system and trying to have these open and honest conversations. If you can, within your family, within your friend group, you have a sibling, you have a friend, just talk to them and ask them small questions like, how are you feeling today? And it's okay for someone to be honest and be like, I'm feeling exhausted, I'm feeling really worn down. Because as much as we try to put the message out there to promote, oh, you should do this, you should start talking, should reach out to people, we need to realize that most people, like you've mentioned in the question, people do not have access to some things. And in such a situation, the best thing you can do is start from home. Charity begins at home, so you can just start by having those conversations, check-ins. How are you doing? I thought of you today, I hope you're doing well. Those small things can really help people because they feel cared for, and it elevates that feeling of isolation, which has been one of the main things that has been bringing about a decline in mental health during this pandemic.
Sure, thank you. So what about Xavier?
Okay, I think Ivy has mentioned a whole lot of things, that could be done during the pandemic, when people are stuck in without going out. How or could we make sure that they still maintain optimal mental health? So I would say that, phone call, it doesn't relate to internet, I believe so, right? So we still have the hotlines, to maintain, phone calls, reaching out to people, reaching out to our friends, our relatives, to know how they are faring. We have hotlines, we spread that across. Anyone having issues in which would love to meet a psychologist, a counselor, or a therapist, you could reach through their phone lines or to the hotlines. And then, interventions or services would actually be delivered. So, and as she also mentioned, I think mental health support system is really key. I think like in Nigeria, gathering, it is allowed to gather at least not more than 10 or not more than from 5 people up to 10. So I think if as a psychologist you really have the heart of helping the people, you can also structure, a support system or a support group whereby you have just 4 persons in it, you have just 5 people in it, including you. So by that, even if you have a lot of people, you could schedule them to meeting like 3 people in a week, and then you have the opportunity of meeting these people with diverse problems, and then you would actually have the opportunity of helping them. You know, who could knows? You would have someone who is about committing suicide, and that would be really great. Thank you.
Yeah, interesting. That's a lot of our information right there. What about Avinash? What do you think?
Yes, actually, I prefer that we can here we mention that if we don't have an internet connection, so we prefer to talk with the phone, or there is something like that, some place where we can not too much, but as said that the 3 to 4 people we can meet, we can help them. Or sometimes it's like that in India we face that people above sometime mental health they need some of help which we have provided them, and actually it's also release their mental stress and everything. So some of the charity level of work can it also help the people. So this is how telephonic, and if the internet we have shared some positive thoughts over there through the internet, even through the text messages. So it worked out in this
Yes. So what
tough
about people in
time.
the village? You know, we're talking about village with the restrictions where you really can't do a lot. So I know Xavier was talking about, you know, you can try to organize 2 to 3 people to meet, but again, there's restrictions. So people in the village, no internet, no telephones. How do we
Yes,
support them?
yes. So generally there are some people you have to come to the government hospitals. They have to come for that. So we have make some awareness campaign or something like that over there. So it helped them
Right. So it's more like
without
saying
talking.
have a place they can actually come
Yes,
to.
yes, yes, and they can see it's like some notice or something like some figure out over there, and so they can see and they can read. Also, it helps,
Yeah, but
and
then
it's
there's still, yeah, there is still the question of the stigma. So, you know, when you're going out to ask for help with mental health, when the stigma is there, how do you, you know, like I'm just trying to see there's this gap between if I was at home in the village and I have that stigma because of the cultural rules or whatever it is, there's no way I'm going to get out and go and read a post and go in for help because they'll know that I've got a problem. So, how does that work? Because there will be people who will struggle at home without any help because they can't do it.
uh, see there is something like that. Actually, as I observe, the doctor actually very familiar with the clients over there, the government hospital. So they can frankly share with their other problems. So it really help out them.
Right, right.
They,
Okay,
Obviously,
I
yes,
think I have something to add to that. You know, in the aspects where you said, you know, people are not going out, all the stigma that people might actually attach to those going out, you know, seeking for help. And, like over here in Nigeria when COVID was really, really devastating, I think. And then one thing was I was amazed, you know, churches were still reaching out to their members, you know, they were still holding services over the radio, over the TV and all those stuff, you know. So at least even in the poorest places, we still have radios. I think so. We still have yes, radios are still there. We still have television, you know, local television and all those. So I think this is, you know, this could be a nice avenue where we could actually reach out to people. Maybe we host programs, you know, on over the radio to talk about mental illness, to talk about depression, anxiety, and how people can actually cope through all this. Even in over the TV, you know, we could, you know, host programs, host shows that actually teach people how they could overcome depression, how they could, you know, settle some psychological issues when they have one. So I think this could actually be a nice and ample area to explore. Thank you.
yeah, I'm also thinking like, you know, if, you know, people who are community health workers, you know, would go knocking doors, in, especially those kind of remote places, knocking doors just to see how people are going as just a welfare check. Because I think a welfare check would be the best way because then you come to them and you will see based on how they look and how they speak to you if they really need support. Because I know for sure, even living in the West, there's people who have mental health issues and there's no way they will go for seek help just because, again, the stigma and all that. So if there was I believe if there's a welfare check on people knocking on doors and saying, hey, we're here because we want to see how you're doing and, you know, that would be a really good place to find out, because maybe most of the families, it's not just one person who lives alone, especially in the villages. They live as a group of people or a family. So then the welfare person might have to just do a welfare check on everybody to see how they're going, what they're doing, do they have food, what's going on in their life, and how can they support them to make things better. Because I pretty much find it very hard when people have stigma with these issues. I don't see them seeking help. And it's just from also experience seeing that around people I know. Unless you really push it on them, they won't seek help. They'll just stay the same and suffer with their problems. That's just how it is. Yeah. So moving on, are the youth actively involved in promoting mental health awareness among their peers? Do we have any youth we think who are involved? Like Ivy, you're a young person. So how would you like to tackle this one?
Yes, we are. I'd like to just begin by saying yes. I guess mostly I can speak about the youth in Kenya and maybe East Africa and that area, because I'm not privy to the rest of the world. But like personally in my community, for example, on Instagram, we have several hubs and several pages that are based on mental health, Kenyan mental health, people you can reach out to. We have websites like Befriend Us Kenya, where you can reach out and call if you need support. And I think that I really love that is that every day is gaining popularity amongst us and amongst my peers and people in our age demographic, is this constant checking in on each other and having a support system. In that, for example, like let me give an example of my organization, like ISEC, where we work. As I'm part of that, there, of course, I'm a vice president, so I have a president above me. And during our meetings, because we have weekly meetings, we'll also have some time, we'll have a check-in session. How are you doing? What's going on? Are you doing well? Even among your friends, you're like, how are you doing? Do you feel like you're struggling? Okay, this is what we can do. Let's crowdfund. We can maybe help you and pay for at least a session or two of therapy if you're really, really struggling. We're also teaching ourselves to have these conversations with our parents, because it can be a little bit difficult. So you reach out to your parent, you're like, Mom, I'm feeling XYZ. I really feel like I need this or that. Because sometimes, also because we are young, there's some things we might catastrophize that we don't understand, that if we go to our parents or to our elders, you guys know what to do and you help us, And it's just these small things, these small steps are making it so that mental health, the discussion of therapy, among the Kenyan youth, it's become like, it's very normal. You'll hear us being like, oh yeah, I can't meet with you on Saturday. I'm going for therapy at 11. It's chill. Call me when you're done, So small steps like that towards removing that stigma, making it normal and making it so that you feel comfortable reaching out.
Great. That's so amazing. Yeah. What about Avinash? What do you think?
What I feel over here, that in India, actually, the youth does not have really the awareness of this mental health. So first, they have to have the mental health awareness. This is very necessary. If they don't know themselves, how they can provide to their peers. So it is very necessary that they first have really awareness of this mental health, and something like that. After that, we can have some motives, some motivation, some recognitions. If they spread the mental awareness in their peers, so it can really help. Because here is the question, that they don't have the mental health awareness in themselves. So this is the issue over here. So first, we have to solve over here that they get the awareness.
Yes, I think also I find like what Avinash you've just said, and what Ivy, you're talking about getting sort of talking to your parents or the people that care for you in terms of mental health and you need therapy.
Yes.
But there is the fear or also the stigma that a parent has the stigma with mental health as well, which would be very crucial, because if you as a young person are aware of mental health and you're trying to educate yourself, give yourself knowledge, learn a lot of how you can cope, and you talk to a family member who's stigmatizing it, can get shut down, like, oh, why are you talking about therapy? Oh, you're gonna embarrass our family. Oh, you're gonna make us look like we're crazy. So it's, I think, also a conversation that the parents need to have, because they also have that cultural stigma thing where they don't want to address real issues because they're afraid of what other people are going to say or think about their family. So you being a youth, it's very brave, and I encourage you to, of course, being in that space to encourage the other young people to actually speak to their parents, because maybe you might be the teacher for your parent. Just because of your parent doesn't mean they know a lot. They also learning on the job and they're just catching on with what's going on. So if you happen to be the one who knows that kind of information, I think it would be wise to find, I know it's not easy because parents maybe most of the time don't listen. They're thinking, what do you know? You're so young. I just gave birth to you. Now you're telling me what to do. But it's opening that space. No, it's a lot of parents are like that, but it's opening that space and saying,
yes,
this is critical. And we're losing a lot of young people to
yes,
suicide. So we cannot pretend that this is not real. And parents, because they're older, they should be able to embrace the younger people with knowledge, because this is actually a real talk. This is not about you trying to ask for permission to go out and go night clubbing or anything like that. You're talking about real issues, which might be affecting your family, friends, workmates. And if one person starts the conversation, and I always say the teacher, we're always the teacher and the student at the same time. And I always say even a 1-month baby can be your teacher, because there's certain things the kid will do and there'll be lessons to be learned. So it's opening that dialogue and encouraging our parents to realize that we are knowledgeable and we want to be in a better space in terms of emotional well-being, mental well-being, and all that kind of stuff. But again, the conversation needs to start with the youth.
Yeah.
So Xavier, what are your thoughts about either youth actively involved in promoting mental health awareness among their peers?
Yeah, I believe it's actually true. The youth are actually more involved in mental health these days. Over here in Nigeria, I think COVID-19 really triggered a lot of interest from the youth aspect, from the angle of the youth, into going into mental health. Like a lot of my friends, I just see them started advocating for mental health, telling people, things to do, some steps to keep, some qualities to keep to, prevent themselves from falling mentally ill and all those stuff. So I've seen that, the interest in the heart of youth regarding to mental health is very high. For example, in the gym, if you look critically into gym ambassadors or advocates, you see that you have a lot of young people in there, people like us, like Ivy and the rest, when they're more, they're all youth, Then if you go online, checking, we have a lot of, pages, a lot of social media pages, a lot of handles that, owned by youth, run by youth advocating for mental health, like the one, the Let Miracle Soko, one of the gym has volunteer created, it's a call that we are psychologists. I'm one of them. We have youth, a lot of them, involved in that. So we could actually reach out to people, and the people can also reach out to us, telling us their problems, and we see how we could, solve these problems one by one. So in a nutshell, we have a lot of youth advocating and then for mental health, and we see that they're actually more interested and even more are coming into it. Yeah. Thank you.
Thank you. Anybody else want anything to add? Is that it? I see Ivy, you're nodding. Avinash,
Yeah, I'm agreeing. Just to comment on something you mentioned earlier, I like that you highlighted that. I didn't want to go into it in case I took too much of the time, but yes, it's true that there is a sort of stigma sometimes when it comes to educating the older generation. But in my experience, what I've learned from trying, because I'm the first psychology major in my family, so what I learned from that is just what I try to do is I just bring up these conversations slowly, bit by bit. And when you introduce them, don't introduce like you're attacking, just be like, oh, grandmother, did you know about this and that? Oh, mom, were you aware of this and that? Dad, did you know that anxiety can be caused from this and that? And just slowly you make it a conversation. You're just talking to your parent, and you make it in a way that you're exchanging information. Just like you said, you're the teacher and the learner at the same time, because they also probably have some good ideas that you can take from and learn from them. And it can be very scary. I'm laughing because I know my mom is watching right now. It can be very scary to breach the conversation. Hi, mom. It can be scary to breach the conversation, but you'll find that they're not as abrasive as you think they would be. Just try, and you'd be so surprised, because when you start that, it sparks this conversation that just from them to their friends, their family. Next thing you know, you've begun this whole just a community starting from a very small thing of a very large support system.
Yes, thank you. Now, before we conclude, I know there's so many ways to protect and manage your mental health and well-being. what is one thing you do for yourself on a daily basis to check in with your mental health and soothe your soul? Ivy, you can start.
Okay, so something I do every day is, which I'm sure most people do, is I listen to music. And some of the music I like listening to music that have a lot of messages that actually revolve around the space of mental health. For example, BTS, because they work with the UN in the Love Yourself campaign, and they have a lot of songs about how you need to give yourself, be true to yourself, take care of yourself, be kind towards yourself, and that everything that you're doing actually is amounting to something, because societal pressure is also another reason that we have a lot of mental health struggles, especially among the youth. The pressure that you want to succeed, and also you don't know what you're doing because you're so young. So I really encourage listening to music that has those messages, that's reaffirming you that yes, I'm on the right path, I'm doing what I'm doing, it counts. Everything I'm doing counts, and it doesn't matter if I fall down, I can pick myself up, dust myself off, and keep on going. Because no matter what happens, even if you find yourself at the pit of depression, if the smallest spark is there that you still want to fight, you still want to be here, you want to be alive, you want to do your best, then you can crawl out of that, and you can find happiness. Just keep on, nurturing that spark. So music, that message.
Thank you. Thank you. What about Avinash? What is something you
Actually,
do every day to check in with your well-being?
yes, I generally listen the music, some of the meditative music, some motivational quotes, and I write in my diary what I have done something good to this existence.
Okay. What about Savior?
That
Okay, I basically do two things on a daily basis to check my mental health. So first, I prioritize my task. I prioritize what I'm gonna do for the day. I set them up, then I work towards achieving those things. And then one thing I do tell people is that I can never achieve all those. I may not be able to achieve all those things. And then the ones I'm able to do, I am very happy with them, with those ones. And then I pick up the next one the next day. Oh, why I'm doing this is because, if you do not actually have a plan of what to do for a day, and then you end up doing nothing, you get worried, you get frustrated, like that day was not productive. So I have this prioritize, my preferences for a day. And then secondly is I practice mindfulness, positivity. It really works. And this is what I teach my clients, mindfulness meditation is key. You might, as you're going on
Okay, I think we lost you.
thereby
I
to
think,
get to make people get to meet with diverse problem. If before you left your home and then you must have said some things to yourself, you must have told yourself, oh, come on, today's gonna be a better day, it's gonna be a great day. Like you motivate yourself before you left the house. So then that happens along the way. I mean, it's that you won't be touched, you'll still be on a normal basis because of the belief you have already. So positivity or mindfulness really helps. And those are things I do on a daily basis to check for my mental health. Thank you.
thank you so much. Yes. So now I can see we all got something we do for ourselves to soothe our souls. So that's also another message to encourage your families, your friends, and everybody, especially Ivy, being in the young youth space, for them to find something that can soothe their soul, something that makes them feel amazing, something that uplifts their spirit. And music, I mean, hey, music is food to the soul for everybody. We love music, and especially music, like you said, music that promotes love, inspiration, loving yourself, being kind. Those kind of things are quite critical, because I think if we love ourselves, we love other people, we're kind to ourselves, we kind to others. And just
Yeah.
positive messages, like Xavier was saying, it's really critical. So now, before we finalize, I'm just making sure we've got a summit next week. I'm just waiting to get the details for that so I can tell our viewers. Now, viewers, if you have any questions, this is a good time to give us some more questions. If you have any questions you'd like to get answered in the show. So we've got about 60 seconds where we can answer some of your questions. So please feel free to ask the questions, because we've got 60 seconds for you right now. Hopefully we get some questions, more questions. Anybody? I can see we've got a few viewers. If you got any questions, please feel free to ask. We've got the 3 panelists who can answer your questions live on the Global Youth Mental Health Awareness Show. Just give it another 30 seconds. If nobody does, then we'll just continue with the show and finalize the show. Okay. All right. Doesn't look like anybody's got a question, but anyway, you can still ask the questions afterwards and we'll still be able to respond to you. So before we finalize, we have the summit coming up, and this is the second revolution. Here are some key highlights to look out for. We're going to have over 60 local and international keynote speakers and panelists presenting from top industry bodies, corporations, and policymakers. We're also going to have 2 masterclasses, a clear roadmap to recognize stress and to create conducive habits and environments to prevent it from destroying your mental and physical health. We're going to have over 100 on-demand webinars available on the platform from some of the biggest names, mental health. And also we have heaps of virtual exhibition stands from leading organizations. Again, that's all mental health. We have our high energy activity with exercises, live music, drama, quiz competitions, awards, and artful performances as well. We have a certificate of participation to boost your CV or resume, global scholarships and opportunities. We also have, they're going to be launching an online course and t-shirt, networking and more. So this is what you need to look forward to. It's going to be amazing. And this is going to be happening on the 28th and 29th of August. So please register. We'll put the details on their screen or in the comments. Register for the summit. It's going to give you a lot of tools, a lot of resources for you to use, and obviously support yourself and others on your mental health journey as well. So 28th and 29th of August, 2021. Please register. We'll put the link, SMR. Oh, this is for the masterclass, but we'll put the link on the comments so you can actually follow through with that. And just before we go, where can people find you, Ivy? Do you have a social media? Where are you?
Yes, the easiest place to find me is on my LinkedIn. My LinkedIn is Ivy Mora, just like my name, Mora with 2 A's. Yes, that's the easiest place to find me. Just email me, message me, connect with me. I'm young, so I need the networking.
That's great. What about you, Avinash? Where can people find you?
Yes, I am also on LinkedIn. My name is Avinash Patel. You can find it very easily.
Right. So that's the name that's showing on the screen.
Yes,
what about
yes,
Xavier?
yes.
Okay, you can find Xavier on all social media handles with the name Xavier Ifyong. I would respond to your messages. Thank you. Great.
And also, if you also wanted to get more information about the Global Youth Mental Health Awareness, you can visit our website, www.globalyouthmentalhealthawareness.org, or you can also email Jude, Jude, @jimha.org. So if you have no questions, it looks like we've come to the end of the show. Thank you, Avinash. Thank you, Ivy, and Xavier, for sharing your insights on ground level execution of youth mental health awareness at a global level. I want to thank you, viewers, for being a fabulous audience and for watching the Global Youth Mental Health Awareness Show. Now, our next fortnight's topic is protecting your mental health at work and school. So until next time, may all you experience the frequencies of love and light. Stay blessed and stay safe. Thank you.
Same to you. Same to
Thank you. You too.
Okay. Just bear with me. I'll stop this.